Hello and welcome to another episode of Local Expert Interviews TV. I'm here with Dr Dix Prasath of Lovesmile Dental in Liverpool, and today we're going to talk about implant dentistry. What is implant dentistry? What you should look for if you're considering implant dentistry, and we're going to get that from an expert in implant dentistry, and that is Dr Dix Prasath. So, hello, Dr Dix Prasath.
Hello.
So the first question we can ask is, can you tell us a little bit about what is implant dentistry?
So it's a field of dentistry where you replace a missing teeth with dental implants, which itself is a titanium screw which is placed into the jawbone surgically, and once it's integrated, it's built with a crown on top. So traditionally, it used to be a denture, and then which is a false teeth, the palate, or then it used to be bridges where you have to file two teeth, and usually you need to have some teeth on either side, and it's a crown and bridge. That's the way it's called. And replacing all these things, currently the latest and the most advanced technology available now is dental implants. And the implant is independent on its own, so you need not really rely on any of the teeth. And primarily, you need to have good bone. If there is not enough bone, you can graft. There are so many solutions. And this is the latest field of dentistry in replacing teeth, missing teeth.
Okay. So can you tell me, I mean, in terms of numbers, how many people have dental implants placed, let's say, on an annual basis?
Firstly, in my practice, I can see there is a 50% increase in the number of patients who have gone for implants within a year. So there are good numbers for going for implants.
Okay. So could you tell me then if I was in need of, or if I was looking for implant, or if more importantly the viewers out there were looking for implants in the Liverpool area, what three things would you recommend that people consider before going into any form of implant dentistry?
As a patient, I would think, like, say, if I were a patient, then these are the factors which I look for. The experience of the dentist is very important. And there is enough evidence to say a new dentist can have a higher failure rate. And the more the experience of the dentist in placing implants, the success is higher. So personally, I look at a dentist who has at least 5 years of experience. Then I look at the general reputation of the dentist in the region. Because it's always better to have a dentist who's friendly and who's approachable for yourself. And that you can find out by the feedback. And a good place to look at is dentist choices. And then you can look at Google reviews. There are so many areas which you can look at. And probably patients who had treatment, you can speak to them and find out as well. And so the reputation is the second thing which I look for. And third major thing which I look for is the technology. As with any field in science, dental implants has evolved so fast that technology has changed, and there are so many technology incorporated into implant dentistry. So if you look at the best treatment possible for yourself, then I look at a practice who has advanced in technology, who has kept in pace with the latest developments in technology and surgical procedures. And you need to find out if the dentist is capable of doing those things as well.
Fantastic. So things I've picked up on there are experience, reputation, and technology. If I was to push you for anything other or anything else, other factors that you should consider, what would you suggest that patients look for?
I'll also look for, probably if you're looking at other factors, then I look for the training of the dentist. Because currently dentists can place an implant with 1 week training, which I think is insufficient. So if you look at the training of the dentist, if they have had proper training for at least 2 or 3 years under supervision, and then you can look for the track record of the dentist itself. There is no point looking at the general success of implant treatment. It's better to look at that dentist, that particular dentist, to see how successful they are in placing implants. Then it's also good to look at how accessible the dentist is. Because if you need any help, if you need to work around your work pattern, then you need to see whether the dentist is accessible when you need them. I will also suggest that it's better to look for a dental practice where the dental implant surgeon is in-house rather than dentist coming from somewhere doing the implants and going away. In such cases, if you have any problems or if you have any doubt, then you have to wait for the other dentist to answer your question. So it's always better to have the dentist in-house. The other thing which I look for is the range of treatment available. Dentists can replace a single teeth. Some people can do a full mouth. So you need to look at whether the dentist can do a wide range of treatment and what is available in that practice. And there are scenarios where you will need grafting, augmentation, sinus augmentation. There are so many things you can do, and you need to see whether this dentist is trained to do all those things. And if you have a wide range of option to select from, rather than sticking to a particular single option. I'll also look at the type of implant used. You look at the history of the implant company, whether they have good reputation, whether they have a history, whether they have good research and development. And one final thing which I look for is if the dentist is using the right type of implant in that scenario, because there are so many types of implant which are indicated for different places, different pattern of placement. So we need to find out whether they're using the right type. And you can ask the dentist as to what implant they're using, whether it's the right type. Then you can go online, you can find it yourself.
Fantastic. So, can you tell me then more about Lovesmile Dental? Let's say, somebody in the Liverpool area, they want or they're interested in dental implants. Can you tell me what makes Lovesmile Dental different from those in and around the Liverpool area?
So here in Lovesmile, I do the implant treatment. And personally, I have a master's degree in respiratory aesthetic dentistry, and I also have a master's training in implant dentistry. So my training is more oriented to implant dentistry and the restoration part of it, and I do it yourself, and I'm available full time in this practice. We also keep in pace with the latest technological advancements, and we have some of the most advanced technology available in entire Liverpool. We have a laser unit. So basically, I can place an implant into an infected site or an infected bone. Traditionally, you used to rely on just surgical curettage. You scrape the implant site, assume the site is clean, and then you place the implant, expecting a healing there. Whereas currently, I'm using lasers, water laser equipment, where I rely on the power of laser light to clean the implant site, which is more thorough, and laser light is bactericidal, which can kill bacteria. So I'm more sure that the site which I place the implant is free of bacteria. So the healing is better, and I can expect a higher success rate. Or in other words, when I do implant, it's more predictable. We also have a CAD/CAM unit, which means I can do an implant from start to finish, including the crown on the same day. So I need not really rely on a lab to do my crown. I have the equipment to do it on site. I also have a PRF machine where the blood of the patient from the vein is drawn from the vein, and is a centrifuge which splits the white blood cells extra. And then we use that to do the grafting part. So the healing is faster, there is less pain, less inflammation, and the soft tissue comes out beautiful. So we look at minute aspects of implant success when it comes to success. And personally, we have a very high success rate of 99%.
I mean, one of the things that you talk about, and I guess all patients should be wary about, is success rate. What happens if you're not from the Liverpool area, or let's say you go on holiday and your implant fails? What happens in those circumstances?
Implant failure, it doesn't come overnight. It's not fast, actually. There are, say, different types of failure. I broadly classify implant failures as restorable and non-restorable. So if an implant is completely loose, you really can't do anything. You just have to get the implant out. You can graft the site and then wait for the graft to integrate and then redo the implant, the whole process again. Whereas the implant is firm, then what I can do is I can use lasers to go around, clean the implant, the infected site, and then regraft it. So the problem here is traditionally, you can't eliminate a bacterial biofilm or infection which has been built onto implant. Implant, because it's a screw pattern, when bacteria loads onto the threads, it is almost impossible to eliminate that bacteria. And in lasers, it's a contact-free pattern of eliminating bacteria. It's a laser power which is aimed at the infected site, and that destroys the bacteria, killing the bacteria and eliminates the biofilm. So you get rid of the infection, and then you can graft it at a later date to build back the lost tissue. And when it comes to implant failure, peri-implantitis, this is a common failure where the patient can have pain because of infection and inflammation. And it can be also peri-implant mucositis, which is just the inflammation of the mucosal tissue around the implant. Very rarely you can have a fracture of the implant. In that case, then it's better to remove the implant and redo the implant again.
Fantastic. So, what about then if somebody in the Liverpool area is interested in dental implants and they come to Lovesmile Dental? Could you walk us through exactly what would happen from the first point of contact?
The first appointment is a very simple one actually. You just literally come and we have a quick look, see what you need, and then based on that, I give you a longer appointment. And then it's during the second appointment we go for the full investigation. X-rays are done, photographs, study models, whatever is necessary. We get gather all the details, and then I come with different treatment options that will be personalized as a patient for you. So based on your basic need, a wide range of choices will be given, and then discuss through the advantages, disadvantages, cost, and everything for the patient on the second appointment. Then the patient have a chance of going home, doing all the research, and then there's a third appointment where they come in and they can clarify any doubts they have based on their own research and the information that I have given. Now, once they're happy with all the information that I have given and they come with the preferred choice, then the appointment for surgery is booked in, and then the implant placement is done. And usually, if possible, I do the implant the same day and finish off the loading. At some cases where the bone is not good enough, you have to wait for the healing and then you do the crown part. And in the full mouth case, we have a few more appointments where the temporary is done prior to the implant placement. And at the time of implant placement, you have a fixed bridge fitted the same day. So there are different protocols based on the type of implant or the pattern of implant you're going to go for and what you really need.
Fantastic. So there we go, everybody. You've got some great advice there about what you should be looking for in dental implants. And I guess, Dr. Dix Prasath, one last question. Is there anything else that you would recommend that patients look for?
Personally, I would think whenever a patient is looking for implant, it's better to look for the quality or the type of implant being used. And one major thing which I emphasize to all my patients is go for an implant which is available globally. In other words, if you go abroad, you should find a dentist who can deal with that type of implant. There's no point going for a cheap or budget implant, and if there's a problem, you'll have to go back to the same dentist who did the implant, or you have to go searching for it. So implant availability or a global company which does the implant and provides across the world, that's one thing which I prefer to go for. And I personally would think it's better to go for the best implant possible, because you don't do implants every time. It's probably a one-off in your lifetime. So you go for the best implant which can last your lifetime, and try not to go for cheap or budget implants when you do implant treatment, because it's something which is going to be a part of your body. So go for the best.
Fantastic. So there we go. If you're after quality implants, then I suggest that the best person to speak to in and around the Liverpool area is Dr. Dix Prasath. I'm going to put Dr. Prasath on the screen at the moment. So if you have any questions for Dr. Prasath about dental implants or dental health in particular, then his number's on the screen now and you can call him. Dr. Prasath, I just want to say thank you very much for coming on today. You've shared some great information for us and for all the watchers out there. So thank you very much.
Thank you.
And to all the viewers out there, thank you for watching another episode of Local Expert Interviews TV. And we look forward to seeing you on the next episode. Thank you.